This next case is the endovascular management of a ruptured ICA bifurcation aneurysm. We examine the properties of two different microcatheters in this case. This is a 35-year-old female who came into the emergency room with the worst headache of her life. While she was awake and oriented to person, she had no cranial nerve deficits and no focal deficits. The CT scan showed diffuse subarachnoid hemorrhage, and the CT angiogram showed a small aneurysm at the dorsal wall of the right ICA bifurcation. Here is a CT scan showing some mild hydrocephalus and subarachnoid hemorrhage. The CT angiogram here confirms the presence of an irregular shaped dorsal carotid wall aneurysm. You can see from this aneurysm that it does have a favorable dome to neck ratio, but it is quite small. Here we'll use a triaxial system in order to have better stability, given the fact that this is a small aneurysm and it is a ruptured aneurysm. We like to navigate the wire distal to the aneurysm to prevent any inadvertent perforation as we bring up the triaxial system. Once we're past the aneurysm, we're going to pull back the system, and the wire often clicks into the aneurysm. Once the wire is in the neck of the aneurysm, we'll then bring the microcatheter up under direct visualization, under high magnification technique. Here we can see that we're bringing in an Excelsior XT17, parking it at the neck of the aneurysm. Once the catheter is in stable configuration at the neck, we then are going to try to deliver our first coil. But as you can see, this catheter does not want to have a stable configuration and continues to herniate from the aneurysm neck into the parent vessel. Our second attempt using this catheter yields the same result. After this, we elect to change the catheter configuration. We downsize the catheter and attempt to use a head-weight duo. As you can see, we have wire purchase of the aneurysm as we bring up the new microcatheter. We withdraw the wire, which leads to forward placement of the catheter in a deeper position in the aneurysm than we had with the XT17. Now we bring up a similar coil and slowly coil the aneurysm. You can see how much more stable this catheter is in this position. We finally bring up our finishing coil. Once this coil is placed, we're going to do final angiography runs confirming coil packing of this aneurysm. As you can see from this angiogram, we have excellent packing of the aneurysm at the termination of this procedure.